we are asked to do more contact tracing, we are asked to do more testing in all these areas. Even the containment measures are to be done in these areas.
It's very important that we be proactive, we take steps right now. If we see a surge in cases in any area, we test and see if it is the Delta Plus variant, we develop containment strategies.
It would be difficult for me to say whether second wave has gone. No, we are still having somewhere around 60,000 new cases every day.
Hello everyone, you're watching News Epicenter with me, Maria Shakil. COVID cases may be coming down, but we are not out of the woods yet. In the last 24 hours, over 50,000 COVID cases have been reported and over 1,300 deaths. As the unlock drive expands across the country, as expected, standard COVID protocols like wearing masks and social distancing are being openly flouted in the big cities, with millions at markets and public places every day. In this scenario, there is a dangerous mutant strain which is expanding its footprints, the Delta Plus variant. A mutation of the Delta strain which devastated the country for 2 months during the second wave has emerged in 6 states. Over 40 cases have been reported in Maharashtra, Madhya Pradesh, Kerala, Karnataka, Tamil Nadu and Jammu and Kashmir. One fatality has been reported in Madhya Pradesh and the state government says the patient was not vaccinated, which made him more susceptible to this virus. Maharashtra has ramped up test and trace protocols to keep a track of this mutation, highlighting that no fatalities have been reported and no children have been infected. The Delta Plus variant is active around the globe and experts say it is more transmissible, more resistant to known treatments, and there isn't enough data to know how effective vaccines are against this mutant. The center has called it a variant of concern, saying that under no circumstance should we let our guard down. The Union Health Ministry has issued an advisory to states to implement immediate containment measures, enhance testing and tracing, as well as boost vaccination drives in districts and clusters where the variant is found. Before the beginning of the second wave, we saw similar signs of mutant strains increasing the risk of transmission and fatality. As cases of the Delta Plus variant rise, experts are still trying to decode how to effectively tackle this mutation. So what should be the road ahead to deter this variant from spreading? How is it likely to impact treatment and vaccination protocols? And are we unlocking too soon before we fully understand this variant? Because the past has shown the minute we unlock, COVID protocols go out of the window. Joining me on the show, Dr. Naresh Trehan. He is the CMD of Medanta. Dr. Anupam Sibal, Group Medical Director, Polo Hospitals, and Dr. Shashank Joshi is the member of Maharashtra COVID Task Force. I'm going to come to you, Dr. Trehan, first. With cases on the rise, is the Delta Plus only extending the second wave?
Yeah, so we don't know the exact data on that yet, but needless to say, it's very worrisome that this Delta plus mutation has been very, from what we know already, is 2 ways. One, it spreads much easier, and that is much worse in its infection to the people who get infected. So if that's the case, then we are faced with another kind of deadly, you can say, a situation where we must be double down on our being very, very careful in what we do going forward. So the issues that come up is, okay, the second wave, but don't forget, being that 60 are still, the first wave, we're in the middle of it. So it's not that it's gone away. We should not behave like it's gone away. And some things that are happening, Now, opening up too soon, I think that we have opened up, we need to open up, but it's not been in a stepwise manner that it should be.
Okay.
Yesterday, they opened, I just want to make this point. I go this example. Delhi opened bars, yes. It could be a bigger super than a bar. What do people go to a bar for? They to drink, take a mask, lose all their caution, and then God, if even one person has it in that whole place, everybody will get infected. So we have to be very careful.
Dr. Trehan, just help us understand, is this the variant which played the role in the second wave? Was this the variant that created that kind of high infection and fatality in the second wave?
Hello?
Dr. Trehan, if you can hear me.
I hear you, but you're broke in the middle.
Yes.
So just repeat the question.
So I want to understand from you that is this the Delta plus variant or the variant which propelled the second wave, which led to that high level of infection and also high fatality?
No, there is no real evidence to say that was purely responsible for the second wave. No. This has been discovered in the middle or toward the end of the second wave. And like you're saying today, if the tracking is right and the surveillance is right, there are 40 cases right now. This Delta variant is more dangerous for the future. Whatever has happened has happened. But whatever the variant was or whatever the construct of this infection was, in the second, it has done huge damage. People got much. Many people died. We have seen which are destroyed by this second. So if there is a precursor to the third wave, which may have even viruses, what does it mean? It means that we must double down right now. We must be enforcement of appropriate behavior has to be brutal. This discipline has to be now, shops and everything, but that doesn't mean hundreds of people can come into the market. You saw the pictures. Why can't we do open up? We want people not to suffer the economics of losses that they have been suffering, but it can be done in a stepwise manner, because if we have to go cold lockdown again, that will only be devastating to everybody.
I'll get your audio fixed in the meanwhile, Dr. Trehan, because that's really choppy. Dr. Joshi, come in on this. Since Maharashtra is one of the 6 states where these samples were found, what's the treatment protocol that is being followed?
First of all, Maya, I want to educate 3 things. Number 1, the second wave was Delta and not Delta plus.
Okay.
And in parts of North India, there was also Alpha strain. So that is the first thing. The second thing is that the so-called Delta plus is nothing but an unusual AY1 mutation, which has been seen in United Kingdom and Nepal before through a genomic joint project between Government of Kerala and the Institute of Genomics and Integrative Biology, Government of Maharashtra, and the same institute has been doing systematic genomic sequencing from each district of Maharashtra. So from 36 districts, 100 samples were sent every week from the month of April till date. And most of these samples where a variation has been found of AY1, which now people call it quote unquote so-called Delta plus, has been a small number of cases from a geography called Ratnagiri and Jalgaon, and one place from Palghar. So these numbers are too small.
Okay.
And all these patients have recovered now. More than 4 weeks have passed, and there is no need to panic, but the data is scant. So this is a new variation, but it's flagged off as a variant of concern and not variant of interest by Government of India, because it's a Delta. So Delta is more transmissible. Okay. Is it as transmissible as the original Delta of second wave? Because we are still in the second wave. Probably we don't have adequate samples to make that analysis, but it may be a little less transmissible. Does it respond to medicines? All the patients have responded. The data from UK suggests that for a single antibody, not multiple antibodies, it may not respond. And it may have a little more virulence on the lung. But that has not been seen in India on the cases which have been there, except for the outlier from Madhya Pradesh. All the cases have been recovered. These areas have been micro-contained, perimeter limitation has been done, and we have sent more samples for genomic sequencing in the month of June, for which we'll get data by next week. So currently, there is no need to panic, but we cannot be complacent. Okay. As far as the so-called Delta plus might actually be a Delta minus and may not be as ferocious as it is thought to be. But the current challenges which we are seeing is zero tolerance on COVID appropriate protocols and behavior has to be maintained. If we fail there and we don't vaccinate 70% of the population, we'll have a challenge. The second challenge with the so-called Delta Plus or the so-called AY1 is it may have an immune escape from some of the vaccinations.
Okay.
So that could be a challenge in the future, and therefore we may need to rework some of our vaccine strategies.
So thanks for that very, very reassuring opening comments, Dr. Joshi. Dr. Sibal, so are the vaccines effective or ineffective on this new Delta Plus variant?
Good evening, Maria. Great to be back on your show. So the thing is that don't about the Delta Plus variant. It's been described in 11 countries. We have a handful of cases in India. The good thing is that we have a very solid genomic, assessment system, INSACOG, that's been set up by the government. We are now doing more and more, genomic analysis, which means that we will become aware of the emergence of how this Delta Plus variant, if at all, it spreads in other parts of the country. And that's really important because, a few months ago, we weren't as strong. Now, in terms of vaccination, now we've gone through so many variants. We've gone through Alpha, and now we have Delta. And don't forget there are 24 letters in the Greek alphabet. So we are going to get more and more variants. And every time we get a variant, we have to look at, hey, what's in our hand? We have vaccines that work. Our data, and we've looked, and I shared that with you earlier. We looked at the, earlier part when the vaccination started in January, and then we looked at the second wave, and we looked at the genome of healthcare workers who got infected. And while in the first period, in the first 100 days, it was 48% Delta. And then in the second, we had 78% Delta. But despite that, only 2 healthcare workers required admission, and no one went into the ICU. So even with Delta, we did have vaccines provide protection, and one would hope that that protection will last with Delta Plus. Now, will it go a few notches less than what we saw with Delta? One can't really, at this point in time, comment. But what we have in our hand is that we need to have a strict reinforcement of COVID avoidance behavior, and we are seeing that that's not happening. People are becoming very, very casual. So whether we have this variant or tomorrow we have another variant, that is in our hands, and that needs to be reinforced. One. Second, we do need to vaccinate. The pace is great. 8 million, 5 million, 6 million last 3 days. Fantastic. We need to carry on with that. Third, we need to learn from the second wave. When Maharashtra hit 10,000, exactly a month later, Delhi hit 10,000. Now, if Maharashtra for 7 days was less than 10,000. Now, if it consistently goes up, that means everyone else also needs to be vigilant. One doesn't have to wait for weeks. I think one should make an assessment in days. And as Dr. Trehan was saying and Shashank was saying, that we need to calibrate our response in terms of what we open and what we don't. So, it's not like, you lock down and then, we go from one extreme to another. But if the cases rise in one part of the country, they will rise in other parts of the country unless we bring in measures to contain. People will travel from one place to another. Right. So we need to be very cautious about calibrating our response. And I think that's a huge, huge learning from the second wave. Then, we cannot wait.
Yes. So in that case, Dr. Trehan, is there a need to revisit also the gap between the 2 vaccines as far as Covishield is concerned because of this new variant?
Well, the Brits, the UK government has already changed it back to 6 weeks, 6 to 8
weeks, and so. So I think, yes, we should seriously look at it now that the vaccines are becoming available, and we are hoping that in the next week or 10 days, another boost will happen to the number of vaccines available. But the other thing that we can do, which is which can help here, is to create a vaccine passport. People who have been vaccinated twice, and there is after 2 weeks of that second vaccination, they can get a vaccination passport, which says that they are protected more so than others. And if there are events that need to be where people need to go, then that passport will come handy for entry. And this is even for travel. That this will do 2 things. One, it will save people, because what does it mean? If everybody around you is vaccinated, you're herd immunity. So that's one way to actually contain it in the interim period. The other thing, it will encourage people to get vaccinated. That hesitancy will go away because they know that they can't get the privileges if they are not vaccinated. So these kind of things can be used to especially for high spreading areas like restaurants, like bars, those kind of events will have to be regulated somehow so that we do not suffer this kind of velocity that we experienced
Okay,
in the
Dr.
first
Trehan,
wave.
it from variant of interest, this became variant of concern. This, of course, is based on some evidence of easy transmission, severe illness, reduced neutralization of antibodies, or reduced effectiveness of treatment and vaccines. What do we know about this variant then?
The two facts that we know, that it has got a RO factor of which is more than what the previous ones were. The second, that the virulence with which it attacks is much more, because it supposedly attaches to the lung receptors much more effectively than the previous variants. If that happens, that means that people will suffer even worse lung damage than they did in the first wave or the second wave. So I think I would say, please, again and again we say, oh, of concern or not concern or observation. That's not the issue right now. We are in the middle of a devastating pandemic. We need to go a step ahead and say, we are worried. No concern. We are worried. We are beyond concern. And if we deal with that, what damage have we done by being concerned? We have only mitigated the problem that may occur if we are underreacting. Overreaction never hurts.
Okay.
Over caution never hurts. So my message will be very clear.
Okay.
That one, people should be worried at their level. The government should enforce very strict regulations as thought out properly, the protocols, and it should be in a calibrated manner. Because the moment we release people in an unregulated manner, what will happen is they're already suffering from COVID fatigue. They are already suffering from cabin fever. Now, it's that kind of, it's a human reaction. It's not like but if they know that there is something to be scared, they will also be very cautious. Because what happened in the middle of the second wave? Everybody got scared. They locked themselves up. I'm not saying that you should be locking yourself up, but you should have a personal lockup in the sense of your behavior pattern.
Okay.
If you can do that, and vaccination is the only weapon we have, the only relief I can offer today is that if somebody gets infected, there is the monoclonal antibody cocktail available, and if it is injected in time, so far it has been very effective in avoiding people from getting sick.
Okay.
So that's another weapon we have in our hand.
Okay. Dr. Shashank Joshi, in Madhya Pradesh, there were 6 youth who have died due to COVID-19. And while one of those who died from the Delta variant had received 2 doses of the vaccine, the rest had received only 1 dose. And of course, there are certain details that are coming in. How worried are you when you look at these information which keep trickling in, particularly with regards to vaccine and its efficacy against this variant?
So these are anecdotal reports. They are cause of concern for investigation. But as Anupam ji has very rightfully said, that, when they looked at large corporate groups, most of the corporate hospitals where healthcare workers were vaccinated, most of them developed mild disease or asymptomatic disease. And most of them did not need ICU, or there were hardly any fatalities. So we have to go case by case in such events. We have to be vigilant. We need to be investigative. But I don't think there is any cause for alarm for vaccine. Vaccines are currently early generation, first generation vaccines. They will definitely prevent death and they will prevent severe disease. You may get an exception or two in that, but we need to vaccinate because we have to saturate 70% of our geography with vaccination. That is going to be the only way we will move forward in this pandemic. Whether there are variants of concern or not, we will have to have some degree of a lower degree and a smaller susceptible population, and a larger degree of either vaccine exposed or infection infused population. So this is something which we need to work on. Yes, you might get an occasional case where you might have a death that needs an audit, that needs an investigation, that needs definitely, and I'm certain that the health authorities will look into every case of vaccine related death, like anaphylactic reaction has been reported by our vaccine group. So there we have to have
Dr.
some
Joshi, you heard from Dr. Trehan here. He says that there is a need to revisit the dosage gap. Are you also of the opinion that there is a need to review that?
So probably it is a supply-demand ratio. Currently, we have an acute shortage. So as soon as there is sufficient stock, probably there will be a change in the policy of a shorter gap. So I think that has to be left to the wisdom. Right now, we are on a vaccination drive. We are just on the waning of the second wave. The second wave is not over. Maya, let us be very transparent here.
Okay.
Second wave is very much prevalent.
Okay.
Even yesterday, 10,000 cases from Maharashtra were reported. 800 cases from Mumbai were reported. In South India, there is very much a large proportion of East and South of India which still has the second wave. We are nowhere out of it for us to start discussing that.
Okay.
And therefore, a large population of India is still not vaccinated. We need to get our first dose in order.
Fine.
And only then, probably the government of India is reasonably smart enough to ensure to reduce the dose to 2 months.
Okay, Dr. Sibal, here are two doctors saying clearly that the second wave is here and it is continuing, that is not over. Then why are we still discussing that perhaps a third wave is 3 months away?
Well, it all depends on how we behave as a society. If we do what each individual needs to do, what is it that I can do? I can strictly adhere to COVID avoidance behavior. I can get vaccinated. I can get both my vaccines. If I develop symptoms, I isolate myself, I get tested and I get treated. And we have an additional, tool in terms of the cocktail in terms of treatment. These are the things that I can do. Now, it will, over a period of a few weeks, we're going to get to know if this 50 becomes 40. And remember, when the first wave kind of ended, we were less than at 10,000 for the country in Feb. We were at 9,600. And here we are at 50,000. So we have a long way to go. Now, in terms of the authorities, I think the authorities are going to exercise a great deal of caution with what is happening, whether it's Delta Plus or tomorrow there's a Kappa or a Lambda mutant. Looking at what is happening in one state and making sure that information, guidance, advice is given so that, the other states can be cautious. And we saw that with the second wave in the south, we did not have as much damage as we had in the north because the states saw what was happening in the north and actually brought in measures. So that's extremely important. And of course, the third thing is that we really need to constantly enhance genomic surveillance because this is really very important. We need to be totally aware of what is happening with mutations, what is happening in different states so that we can have the best strategy. And I think the last point really is that there's going to be calibration and recalibration, whether it's the gap between two doses as more data emerges or as more information develops on variants of concern in terms of what is to open and how often and how soon and what needs to close and when. So I think there's going to be a constant amount of calibration here, and that's really what this pandemic has taught us.
I will give the final words to Dr. Trehan. 30 seconds to you, sir.
So it's very clear. 3 things that we can do. One is our personal responsibility, everyone's, towards yourself, to your family, society, community, country. Second, we vaccinate, and everybody should put their bit in. And like I've said, the private sector hospitals have even offered the government that if we need to give you assistance in delivering the doses to the patients and you need manpower, we'll give it free as part of our CSR to those camps which are being held by the government. Third is the point that we need to have real-time surveillance. Absolutely real-time and action. It's like a war zone.
Okay.
So you have a war room where you see where the things are evolving real-time and then come down very quickly and strict adherence to COVID behavior.
All right. Dr. Trehan, Dr. Sibal, Dr. Joshi, thank you so much for your time and thanks for taking all the questions on this new Delta Plus. As all the experts were saying, the top medical doctors of the country on News Epicenter said clearly that the second wave is still continuing, even as we keep talking about the third wave. Because we are seeing the surge in cases, you have to be very, very careful and cautious. That's all from me. Thanks so much for watching and I'll be seeing you tomorrow.